We're now going to move to a moderated panel to discuss the implications of what we've been talking about all day in terms of the role of service providers in risk assessment, safety planning, and risk management. And joining me today in this discussion are 4 senior, well-respected practitioners in the field. It would take me 30 minutes to introduce them all properly. So to leave more time for their wise words, I'll be very brief and ask you to review their extensive bio in the program. Josie Nepinak is Executive Director of Awotan Healing Lodge in Calgary. Verona Singer, formerly from the Halifax Police Services, Victim Services, is now an adjunct professor in criminology at St. Mary's University in Halifax. Tracy Porteous is an executive director with the Ending Violence Association of British Columbia in Vancouver. And last but not least, Mohammed Baobaid is executive director of the Muslim Resource Centre for Social Support and Integration here in London, Ontario. Welcome to all of you. And when we planned for this session, we planned about talking about 2 major topics, and if we have time, we'll get into more topics. But the things we want to talk about initially are what are some of the big challenges that you see in the field, either from the perspective of your region or the population you work with, or the service sector. And I think I'm going to start with Josie for some of her reflections on the big challenges in the field.
Yes, thank you very much, Peter, for that introduction. I would like to bring greetings from the beautiful Treaty 7 territory and the homeland of the Métis people. So I am in the city of Mohkinstsis, which is known as Calgary, Alberta. So Awotan has been providing services to Indigenous women and children since 1992. So that is approximately 30 years. And we have been using the danger assessment tool, which is the one used by the shelters in Alberta as well. Recently, we did a small sample of 10 women, and we found once again that Indigenous women scored significantly lower by 30% than non-Indigenous women in the area of extreme danger. Then we use the safety plans, the assessment tools for safety planning, to build education and awareness, and we find that over even 1 or 2 sessions and discussing the danger assessment plan with them, the score goes higher. This has been consistent over the past 10 years when we began to look closer at the scores. Now, there is a large body of data around Indigenous women, which we know are severely overrepresented in the stats, and sometimes the data that is collected can be used to further subjugate Indigenous women. Unconsciously, I say that. And women are placed in the context of risky lifestyles. Indigenous women are placed and sometimes labeled as prostitutes, sex workers, bad mothers, addicted, which sometimes lead to increased biases against us. We have heard from Indigenous women in our storytelling sessions of their experiences around judgment, racism, and stereotype. Often these conversations will lead to mistrust and assessment fatigue. For example, coming into the emergency women's shelter requires a large number of information and telling of their story, which they very likely have told several times at this point, and they are tired as they try to make sense of another form. They are in crises. There are multiple layers of trauma, and they will ask, why do I need to fill out another form? How is this going to help me? I know I'm in danger. What are you going to do with this assessment? Will it be used against me? Very, very legitimate questions as we try to understand. The risk factors are sometimes identified by service providers around colonization, residential schools, I guess the question is, are these risk factors integrated into the assessment tools? If so, how? And how have these experiences impacted the perception of danger, homicide for Indigenous women? Is there minimizing of danger? Because we've already been kicked around so much. We've already been to residential schools. We've been scooped in the 60s. We've gone through child welfare. We have been in numerous foster homes. Does that minimize my sense of danger and safety? Possibly, because of the multi-layers of trauma and abuse. Indigenous women's experiences have been shaped by through genocidal legislation, policy, and process. For example, mass killings of Indigenous women, forced sterilization, forced removal of children into the residential schools so that they may not be with their savage parents, child welfare, remove them from their families, starvation of children, electrocution of children, leading to complex and multiple layers. Now, in having said that, there appears to be a growing body of literature to validate the need for culturally responsive assessment tools. So I'd like to just talk a little bit about the considerations for future work research for service providers to take into consideration. A thorough understanding of genocide as it is described in the Missing and Murdered Indigenous Women's Inquiry Report must be thoroughly understood. And this should also include the contemporary realities of Indigenous women today and the ongoing colonial violence and structures that continue to oppress Indigenous women. Further, I cannot stress the fact that practitioners, researchers, and service providers must work with the community, work at the community level, build trusting relationships, understand how communities interact, and what is the language of the community. When people are in stress, people are in crisis, when people are not in good health, they often revert back to what they know best, and which is language, culture, and ceremony. Attend community processes and get to know what the cultural practices are. Further, talk to Indigenous women. Let Indigenous women tell you what they need to be safe. Develop a comprehensive and learning strategy for your community and your organizations. Also, just very briefly, I'd like to say also as a possible for the future as well for best practice is to look at the definition of domestic violence and to include a definition mix of the definition of domestic to family violence and have a mixture of some of the experiences of Indigenous people. This was suggested back in 1996 when the Royal Commission on Aboriginal Peoples did their final report and talked about the fact that Indigenous experiences around violence were similar to everyone else, but we also have to acknowledge that violence against Indigenous peoples happened in whole communities, and that these communities continue to be affected and is shaped on how violence is perceived today. And I'm going to stop there, and then we will. I'll answer any questions later. Thank you.
Okay, thank you very much. Over to you, Verona, some of the challenges that you see from your perspective in terms of the work you've done in Nova Scotia.
Sure, certainly. So thanks to Peter and everyone for being here in this session. So what I'm going to talk about are challenges for police and safety planning and domestic violence. So the first challenge was identified this morning by Peter: training, and more training. So he commented that for over 40 years, the training has been an ongoing issue for police. And as my role as victim services for 20 plus years with the Halifax Regional Police, domestic violence training and improving our training to police officers was a large part of our jobs. I remember a deputy chief stating in frustration that there is only so much time a year to do police officer training, and there are other training demands on police with high expectations. Domestic violence training competes with these other demands. The second challenge that I note is that patrol officers police officers deal with multiple situations. They're general practitioners. They deal with multiple situations each day and are expected to have the requisite knowledge and skills to provide the highest level of safety and service. Despite the training they may receive, patrol officers' knowledge base on domestic violence is not deep. Patrol officers do not have an expertise base of domestic violence, and there is an expectation that they should. Many police officers want to do a good job, but when it comes to responding to domestic violence, there is inconsistency across the board. The third challenge that I see is the lack of commitment to domestic violence at the senior management level in policing. So this lack of commitment to address and respond to domestic violence is not a priority area in many police departments. Domestic violence cannot be a flavor of the month. It needs to be embedded in the department at all levels, in senior managers' mandate letters, in departmental business plans, in police budgets, and police governing boards. Even though less than 30% of victims of domestic violence report to police, responding to multiple domestic violence calls is a daily occurrence for patrol officers. And finally, I think one of the challenges for safety planning with police is the lack of community policing. And Josie spoke to that about the community. Police officers don't know the people in the communities that they patrol. So the people do not know the police officers. In communities that are under-policed or over-policed, are Black, Indigenous, or people of color, the rainbow communities, immigrant communities, this lack of relationship between police officers and community residents creates barriers where the community does not call the police and where the police do not respond well to the domestic violence needs of the community. Thank you.
Mohammed, going to turn it over to you about what you see as major challenges, especially from the populations you're working with and your specialized agency that you have created and are now leading.
Yeah, thank you very much, Peter, and I'm really delighted to be part of this very important conversation. I'm going to focus a little bit on a specific group of isolated immigrant and refugee women, based on my experience working with Muslim families and also survivor of domestic violence. So before we talk about risk assessment, risk management, and safety planning, I would like to focus specifically on one particular area that's not really covered in many of our conversation, and that is really challenges that mainstream service providers would face to reach out to those isolated women. Not because they are not really aware about the services, necessarily, or maybe because of language barriers. I think maybe most importantly because their psychological dilemma, not really willing or maybe hesitant to ask for outside help from outside their community or maybe extended families. And in particular, I would like to talk about women who maybe for their maybe circumstances, they would be more reluctant to ask for help because of the consequences that could impact their ties with their family, not just really here in Canada, but also maybe in their country of origin, as well as to their country, to their community of origin. And I would like to highlight here 4 major factors that maybe make this the situation of this group of women more difficult to ask for help. Number 1, that's part of my observations. Maybe because they are really strongly connected with their faith and traditional cultures, which really put them under a lot of pressure and responsibilities, Second, maybe they will be belonging under families with higher leadership status culturally or religiously in their community. So the third thing maybe could be also, as many mentioned, discrimination, experiencing discrimination and racism, and also maybe the fourth factor, they are new to Canada. If you look at those four major factors, of course, they could be also really real for other, isolated immigrant and newcomer communities, but specifically for this group, because the implication of asking for help would really put the family and the community down, and they don't want to be feeling they will be the one who will be causing this kind of damage to the community. So on the other hand, if you look at how service providers are addressing, and responding to the needs or to the unique needs of this group of women, I think there is a lot of limitation. First of all, maybe because the way service is delivered based on knowledge sharing, promoting for what is available there. And that's not enough, because then the expectation is women will come once they are aware about the services and ask for help. For this woman, or for this group of women, I think they need to create different kind of strategies. First of all, to reach out to them and to build some kind of trust. And also really, so the other thing also, if you look at the service delivery model, it's really constraints with policies, procedures, liabilities, legal framework. So as a anyone who is really working in this area, violence against women sector, difficult really to maybe sometimes make what is common sense, because everything they want to do something different, they will think of the consequences on really their position in their agency. So in summary, I would say those group of women would maybe, if we look at the challenges that they're facing, on one hand, this challenge is related to their community circumstances. On the other hand, the service is not ready to provide more flexibility to accommodate in order to be able to meet the unique needs of this group. And I think maybe later on I can talk a little bit about some of the promising practice. And thank you.
Okay. I'm going to turn to you, Tracy. So you've been in this field working at it for 40 years, and are there still some challenges ahead? And if so, what are they? What do you see as major challenges?
Thank you, Peter, and thank you for the invitation. I'm thrilled to join this esteemed panel. I'm talking to you from the territory of the Tsleil-Waututh, the Musqueam, and the Squamish peoples in the beautiful west coast of Canada. And yeah, I would say that when we tend to talk about domestic violence risk factors, we're usually focusing on things that are inherent to the offender or the victim. We're constantly kind of focusing on, was there previous violence or previous domestic violence perpetrated? What is the use or increased use of alcohol and other substances, sexual assault, strangulation, access to weapons, and so forth. But I think that one of the things that we need to do better is to look at and identify the lack of coordination or the lack of training amongst community anti-violence people, police, Crown, judges, family violence lawyers, child protection staff, Indigenous services, immigrant and refugee service staff. If those people in any given community don't have the training that they need to understand the dynamics of domestic violence, and they don't have a coordinated response, I believe that we need to see that as a risk factor in and of itself. And when you look at many of the risk factor tools, risk assessment tools across the country and beyond, very few are really focusing on the community response itself as a risk factor. I think we've done amazing work, and Peter, you've been one of the leads of that in our country and beyond, of advancing the science of risk factors that can help us say with absolute confidence that domestic violence deaths are the most preventable of all homicides. And I think that, because we know the risk factors, which is kind of like a similar trajectory in the healthcare sector, as they're able to find markers in our blood for cancer and other medical issues, that we can now identify a series of domestic violence risk factors when presented together, really help us understand the need for elevated action. But I don't think that what we've done so commonly yet across our entire country in communities, rural and urban, is to understand the extent to which an unprepared or untrusted, uncoordinated system with untrained players is actually a lethal risk. And I think that this is even more evident when you layer on racism and classism and ableism and heterosexism and all of those other issues that populate our society, that create dangerous barriers, which should otherwise be access to trust and support. And layer onto that the silo effect that I think still pervades many of the responses in Canada. And again, even though we've come a long way with respect to a lot of evidence and reports and coroner's reports, and many communities taking action and putting in place a coordinated response to domestic violence, I just don't think it's yet commonplace for risk assessment and safety planning to be done with all the right people at the table. And so I think that if our gaps in our systemic response, and there's gaps in training, and people don't share information with each other, like police with community anti-violence or child protection with corrections, if that information, critical information as risk is escalating, isn't shared, we may miss key opportunities to save people's lives. And I think this is even more evident when you're talking about communities, cultural communities that are historically left out of the table, off the table when we're talking about designing responses and programs. And I think that if we look at this, a tragic situation that took place in British Columbia a number of years ago, where Sunny Park and her whole family were murdered by her husband. She was a Korean woman who came to Canada and married a Korean Canadian. And one of the things that, was very evident in the case in hindsight is she was kind of speaking what we've all come to understand as good enough English. She didn't know the word for sexual assault in English. She didn't know how to explain that to the police. And had the police had access to cultural interpreters at a risk assessment table after she had reported to the police that she was afraid that Peter was going to kill her, but she wasn't really necessarily communicating all of the sequential risk factors that the police understood at the time. Had there been cultural interpreters available to the police, people from the Korean community or people from settlement programs helping the police to understand, it's very common for people to get by in good enough English, but when you're talking about something as critical as life and death, you need to have a language interpreter brought to the table so that she can explain what's happening to her in her first language. There's another case in British Columbia, another tragic case of a South Asian man who was arrested for committing egregious violence against his wife. And he was arrested and incarcerated, and then everybody thought that she was safe. But had there been a risk assessment table at the time with people from the Sikh community at the table, able and ready and willing to provide information to the people assessing risk and developing safety, they might have heard that that his family was out for blood because he was in jail. And in fact, what happened in this case is that family members of his came back and committed other crimes against her. So I think one of the gaps still for us is making sure that all the right people are at the table when we're doing risk assessment and safety planning, not just victim services and police and corrections and child protection, but Indigenous services and settlement services and English language teachers and people who are providing services to queer and trans and two-spirit communities. Because I think that the more robust our understanding is of what's happening in the life of these folks that are at risk and the offenders committing violence, the more likely we're going to be able to create a safety plan that actually works.
That's great, Tracy. Thank you very much for that. We have about 12 minutes left, so if we divide it up 4 ways, that's let's say 3 minutes a person to think about promising practices. Again, all of you have been at this a long time, like me, and we haven't given up. And obviously, to keep us going, we have to see things that are encouraging, new things that are hopeful, things that we know are working and could work elsewhere. Could I get some of your reflections about what you see as promising? and maybe start with Josie.
Yes, thank you. Great conversation from the panel members, so thank you. Certainly, I can't speak to. I want to speak to the issue of the collaboration and working closely with Indigenous folks in the communities, and as experts of our own experiences and experts of providing services for Indigenous women, we and I believe that that's starting to change. And if we are to create that social change, we need to have some very, what I call sometimes, fierce conversations around around some of the services and some of the experiences that we currently have, or feeling that there's continue to be very paternalistic processes that I, for one, don't want to get a little pat on the back saying, you're a good little Anishinaabe, but, I'm going to do this for you. So building trust, building relationships is critically important. Know the community that you are working with. Again, language, what is the culture, what is the ceremony? Talk with elders, LGBTQ, cultural practices, and read the MMIW report. It is a very, very extensive document, but if you can, read the executive summary and it'll provide you with the information that you need. Other things that are happening, which I feel that are going to develop over the next few years, are what we call the Bear Clan. And the Bear Clan are groups of folks across the country who are working. And actually in Calgary, we had a young 12-year-old girl who was missing, and it was these guys who found her. They were on the streets. They were. We also have other grassroots initiatives around safe rides for women. So there is a website where Indigenous women in Calgary, for example, can log into if they require a ride to one place to the other. So there are stuff that's happening within the community, for the community, and by the community, that I think that we need to pay attention to as it moves forward. It's about community engagement, building answers through community by community. So thank you.
Thank you. Verona, what keeps you going? What gives you encouragement, and what do you see as promising practices?
Teaching future police officers. That actually keeps me going, because then I get to say what I need to say about policing. One of them is commitment to community policing. Community policing needs to be fundamental value for a police agency and practiced at all levels of the police agency. Building relationships with community members, getting out of the patrol car, getting out of the police station, talking with people on the street, in their homes and workplaces. Relationship building, just like Josie said, between individuals and police, improve the likelihood that someone experiencing domestic violence will reach out to a police officer when they need help. We've also got some great initiatives going on here in Nova Scotia. So we've had for the past 17 years, the High-Risk Case Coordination Protocol. It's a provincial program for high-risk domestic violence cases. Patrol officers complete a risk assessment of domestic violence using the ODERA. If the file is high risk, then it's referred to a domestic violence case coordinator who works with the victim to provide safety planning and support. We also collaborate with other service providers as a key component of this program. And in the 17 years of operation, there's never been a domestic homicide in one of our high-risk cases. We have built on that high-risk case coordination protocol, and Halifax Regional Police created 2 positions. One is a domestic violence police officer who works with the accused. They connect with the accused, which is most often men. They explain the high-risk protocol, what the implications are for the accused, what court information is necessary, and refers the accused to services and supports. We then added on an additional person called a domestic violence offender navigator to work with those high-risk accused in navigating them through the court system, but they're also working with ODERA's 4, 5s, and 6s, which are not quite high risk, but are right at the edge, providing referral supports. And finally, the province of Nova Scotia is developing a provincial highest risk domestic violence table. Health is coming to that table, and that will sit with other service providers, and they will support domestic high risk, the highest risk domestic violence cases that don't come to the attention of the police or the domestic violence case coordinators. And the support is from a restorative approach, and support's given to the victim, the offender, and the community. That's it.
That's great. Mohammed, what keeps you going? You've been at this a long time. What's promising in your view?
Yeah, thank you, Peter. Over 20 years now that I have been, doing this work, and I'm not going to give up. Of course, there are so many challenges, but also really there is so many things that really keep me motivated to continue this work, this important work. I think, everybody was talking about coordination, collaboration. I agree. In the work that I am doing with, immigrant and newcomer, in particular my work with the Muslim communities, what is really missing to have more culturally appropriate, coordinated support and services. I want really to suggest here to really move beyond culturally sensitive services. And I would really suggest here the term culturally integrative, what we are really using at the Muslim Resource Center. With the culturally integrative framework, really, basically, anything that has worked well within, a broader context, risk assessment, risk management, safety planning, we can use it in a different cultural context, and in particular within a collectivist cultural context where many immigrants and newcomers are coming. You are not really here to change, the policies or maybe the laws, but we are really here to modify the responses. So I think, what this is really missing. I think, in our experience at the Muslim Resource Center, because we are a culturally based organization, it's not just really about individuals, it's really an institution. Work collaboratively with all anti-violence agencies and social services, including violence against women sector, the police, and really basically creating a safe space for everyone. A safe space for clients, as I mentioned in my presentation, that usually would not be able to ask for help, safe place for any other service providers. So the other thing also really within this, for service providers really it's about time to share responsibility and authorities with other culturally based organizations. It is really very important to have them on your board, because if you always think the barriers is because of cultural barriers, religious barriers, so most likely you are missing the opportunity to work with them. So we need really to change the way we perceive other cultural communities. There is a lot of resiliency, there is a lot of potentials to be protective factors. We have done that in our risk assessment, but also most importantly, actually, we work with everyone. In many cases, we bring even the imams, and to really make the imam really be an advocate for the women who are maybe experience violence, or maybe also or at risk, or maybe impacted by family violence. Really, that is very important. We need to move beyond culturally sensitive service, and we really start to work on the cultural integrative. And I'm very excited. We have a new shared grant with CREVAC and ANOVA and CAS to work together on this model in the near future. Thank you.
Okay. Tracy, what keeps you going? What gives you a sense of hope in terms of what's being developed out in BC?
Yeah, thanks, Peter. In 2010, we began developing these cross-sectoral teams made up of, and in fact, led by community anti-violence advocates with police, called ICATs, Interagency Case Assessment Teams. And similar to Verona's experience in the Halifax area, since 2010, we have about 60 of these ICAT teams operating all across BC, some in First Nations communities, and many of whom have representation from settlement workers and Indigenous workers. There's been no homicides. And so these teams only deal with the highest risk cases, and they collaboratively assess risk together. They collaboratively create a safety plan, and they collaboratively manage the risk and the safety on an ongoing basis until the risk diminishes. And we have seen concrete outcomes from these collaborative teams. So, obviously a major measurement is no fatalities, but the other measures are an extremely reduced level of recidivism. And another measure is an extremely reduced level of child removals from homes, because you have child protection at the table. You have Indigenous services at the table. You have people saying, I can provide this service. I will do this. I can provide social housing. I can make sure that there's childcare in the evenings. These aren't community members. These are generally service providers. But I would want to just underscore again, and what Josie said is that we can't do any of this work in a silo. And so the fact that we have many cross-sectoral teams across the country starting up, and some of which have been around for a while, I think that what's still missing from these teams is the teams are not necessarily as fully diverse as the communities they're serving. So we need to make sure there's Indigenous leadership there. We need to make sure that there's immigrant and refugee leadership, especially from the populations that are active in a community, like the way immigration or the refugee system works. Lots of times people are sent to work in communities where there's resource extraction. And so there could be all kinds of people from one cultural demographic in a certain community. So you need to make sure that you have people from that demographic in the process, so that when a risk situation arises, there's already, hopefully from a service providing perspective, a trusting relationship. And you also will need ahead of time to ensure that you have the proper authority for police to be able to share information about previous violence and criminal histories, and for corrections to also do that. And, we've certainly done it in BC, and Verona's done it in Halifax, and there's other people across the country that have done it. That was a big barrier in the early days, where people weren't sharing information because they didn't feel they had the authority to do that. And then there were just a pile up of deaths and tragedies. And I think that the powers that be have come to the conclusion that not only should police and others share information, but they're being directed to, because we know it saves lives. And the last thing that I'll say is that, what I'm seeing, and this is borne out by empirical evidence as well, is that the best hope that a woman or a survivor has in surviving domestic violence is having an advocate. As Verona talked about having a system navigator for offenders, well, in BC, we have, upwards of, close to 300 programs. Now, mind you, many of them are only one person part-time, so it sounds like a lot, but we need more. But those people that can be the advocate and the navigator for people that are experiencing violence, because as we know, it's a complex system, and the more marginalized you are by racism and ableism and those other things, the more you need that navigator. Thank you.
That's great. Thank you very much. I wish we could continue the discussion, but I want to thank the four of you for this wonderful discussion, and I also want to acknowledge your tireless efforts for many years in the field. And goes without saying that we appreciate all of you being great partners in this research.